Welcome to our YouTube channel once again. My name is Jerry and I'm here with
Chantal.
yes. And today's discussion is going to be about the healthcare system in the Netherlands. My experience with the healthcare system and some of the challenges and explanations that I want as a foreigner when I came into the Netherlands. And she is going to be the right person to explain to me and to you how the healthcare system works here in the Netherlands. Maybe she might not give you all the full details, but we'll do as much as possible to give you the basic knowledge that you want to find out. So let's get into the video. Welcome back. Yeah, right, I rightly said we are going to talk about the health system here in the Netherlands. I am coming from Ghana, and my experience so far in the Netherlands about the health system, I must say, is mind-blowing. It's one of the best health systems I've ever seen. Why am I saying so? Because of the way they handle everything in respect to health issues. There are some basic questions I want to find out from her because I was in a health insurance system in Ghana. I worked there before. And how the health system in Ghana works is totally different from how the health system in the Netherlands works. The insurance policy alone is different from what we have in Ghana. Every country has their insurance policy. But let's delve into the Netherlands health policy. So, Chantal.
Yes.
So tell me, what is the procedure if I want to acquire a health insurance here in the Netherlands?
Oh, you can go online.
Yeah.
There's nothing then to go to an office. You can go online and look for, I don't know how many insurance companies there are, but there are plenty. And it can be they all have their own policy.
Okay.
The basics will be there, but they can have specific things. Let's say you want to do you need, what must I say, you need birth, want to get pregnant, then you need to think about to have a special package for that, or you have severe back problems always, then you need to require for a higher thing for your physiotherapy. But the basics are mostly the same. But
Okay.
the only thing is you need to pay if there is anything happening to you. The first 385, if I'm not lying, is for you yourself. You need to pay it.
385 euro.
Yeah, let's say you need to go to the hospital for an X-ray. That will not fall from the insurance. It's coming from your own budget.
Oh, okay. Okay. Yeah, okay. As you rightly said, yeah. So it means that the first down payment you have to do when you go to the hospital is 385.
85. Yeah,
Let's say, huh?
Yeah, nee, it's
Depending,
not let's say, it's a stick.
Oh, okay. Okay. All right. That is
Every year it is going up small.
Oh, okay.
The government want to stop that thing, but because some people can't pay, that's what they think. But
Okay. All right. So, because what I want to find out with my experience so far is, when I came here, everything that happens, if she's not feeling fine, I always say, then go and see the doctor. You should go to the hospital. When I came here, because in Ghana, we always go to the hospital when something is wrong. We do not even think about the clinic or the polyclinic. We always say, go to the hospital. So when I came here, everything is different. So can you tell us, when I'm sick, assuming I'm sick right now, where do I need to go to first?
Oh, you go to the huisarts, the doctor. It's kind of
house doctor. That is like a polyclinic, or
no,
clinic is too big.
Nee, polyclinic is
It's
too
big,
big.
yeah.
If you talk here about polyclinic,
Oh, something like a chip compound. In Ghana, we call it chip compound. Like a small.
it's only open on office times,
Yeah, 8 hours.
8 hours.
Yeah.
Then it's closing
Close.
down. Weekend is closed down. So if there is anything, you cannot just walk in. You need to make an appointment.
Yes.
And there comes the thing already. The assistant on the phone need to know what is happening.
Yes.
Like, oh, I'm having a severe cough. And she will ask how long is the cough. She will go for want already some small explanation if it is needed for you to come. And then by the most people is the friction, like, I just want to see the doctor. But I think 9 out of 10 sickness, they are just going by itself.
So, yeah, as you rightly said, because.
And I think that was your,
Yeah, because.
this thing like, why?
Yeah, because I was not feeling fine when I came in the first 2 years. They have something they call here flu. So I got the flu, and I was telling her I really have to go and see a doctor.
Sorry, I need to laugh, but
Because I was insisting I need to see a doctor, and she said, no, it will be okay.
yo, just take your paracetamol. It
Yes.
will be fine.
The
We are
Netherlands.
all getting it.
Like your first aid is paracetamol, whether you like it or not. Paracetamol will be your best medicine in this country.
And cough mixture.
And cough mixture. And the nose spray. And those ones, you get them from the supermarket. Interesting, huh? So if assuming if I go to the doctor here in the doctor and it's a severe sickness, what happens then?
Now, severe sickness.
Now, if I'm
like,
seriously sick and they can't handle it, what do I do?
Oh, if they really can't handle it,
Yeah.
then they will send you to the hospital, and it depends if it is emergency. They will make sure they contact the hospital. You can go straight away. If it is not emergency, like you have, what must I say? You have back pain for long, and they just need to do some investigation. Then they just make sure they will get to the right person in the hospital, but maybe not this week. It can be next week
Yeah.
or later.
It's true. Because sometimes it can be
It
on
depends.
the...
They categorize it
Yeah.
for themselves.
Okay.
And for me, I think sometimes they can also be wrong. I will not say they are always right, but I think most of the things by the house arts are small things.
If they say house art, that is a house doctor.
House doctor,
yeah.
they can have they even do small treatment, cutting your finger, they can stitch,
Yes.
they can do heart, how do you say, I even don't know the English word.
Like what say it in the Netherlands.
Een hartfilmpje.
Heart. If they want to do heart, we'll put it on the screen. We'll look for it and we'll put it on the screen.
Or you have something with your lungs. They can do a lot of things already by the house doctor.
House doctor. Okay. All right.
So
that means
they only let you go through as another doctor in the hospital if it is very serious or the doctor can't help you.
Oh, okay.
Or they need to check you up further.
Yeah. So what happens if something happens to me on Saturday, weekends, and the house doctor is not around? Where do I go to?
Pech. Nee. No. We have an emergency line for also doctors. It are also doctor assistants. Like the one even from, I don't know if our own is not doing that anymore, but some assistants, they also need to work in shifts. Yeah. And they sit there and you get them on the line.
And so you go to the house doctor here in the village or you go somewhere?
somewhere, Gorkum.
In the hospital.
In the hospital.
Oh,
It's
okay.
by the hospital.
All right. Okay. Because I had experience before. Weekend, I cut my finger, and I was bleeding seriously. And it was on Saturday, and I have to go to. They
you
call
need
them
to-
house. They call them house
House-
doctor post. If that's a literal translation.
Yeah.
Yeah, house
It's from the
outpost.
whole neighborhood. The whole area need to come there.
Oh, okay.
So you need to book
You
an
also,
appointment.
you also need to call, book an appointment if it is needed to come or not, because they don't want queues.
How
Yeah.
hard are you bleeding?
Yeah, you always have to give a whole. If it's an emergency, they have a long list on the
And-
telephone for you.
If it is a real emergency, then you just need to call the emergency line.
Oh, okay. Okay, so I hope we are getting somewhere. I hope you are also learning something, because if you are here in the Netherlands, these are some of the things you need to find out. If you are here and you are sick, these are some of the procedures you have to go through. Yes.
Sorry. What were you missing? You are missing something. What did you miss when you came here?
Miss?
Drip.
Oh, yeah. In Ghana, they like giving drip. Yeah, most of because we are in Ghana, we are full of malaria. Malaria is our problem. So when you go to the hospital, most likely you get a drip. But here, I've never seen the face of a drip before. No. No. Not that I fall sick all the time, but no. Even if you get that virus that they mostly in from
This
now
season,
this
yeah.
season, the winter time is full of sickness. People are always sick. Plenty. Yes, the system is full of viruses. Yeah, but you still do not get drip. I can promise you that.
Then you must be dehydrated to
Yeah.
get a drip.
So in the Netherlands, they hardly give you a medicine. They can only give you a medicine if it is needed. If it is really needed, before you can get a medicine. If not, forget it. You go home, you can your paracetamol is your best friend. And so so that is the health procedure, some of the health procedures. So we'll continue. In terms of because one of the most surprising thing for me also is if you are pregnant. If you are pregnant here, what I've realized too is that if you are pregnant, you don't go to the house doctor.
No.
You go straight to the maternity.
I want to say gynecologist. Nee, the
Midwife.
midwife.
Yeah, you go straight to the
Yeah.
midwife. You don't go to the doctor. So can you explain why straight to the midwife and not to the doctor? If I'm pregnant, in Ghana, you go to the doctor, you go to the clinic, and those kind of things.
It was those days back. You go to the doctor, but then the doctor was even doing the deliveries. But then the midwives were coming more and more in. So they took over that thing from the doctor, because the doctor is not doing plenty deliveries.
Oh, okay. So because when she was pregnant, I was thinking we are going to see the doctor, but rather we went to
You go to the
The
midwives. They have
So you go to the
every
midwife.
area has some midwives.
Right.
Yeah.
Yeah. So and secondly too, apart from and if there's something they ask when you are pregnant, they will ask you, do you want to give birth home or at the hospital? Yes. Yeah.
Oh, for me it's
Because in
normal.
this day and age in the Netherlands, they still give birth at home, which is very surprising. I don't know why. Yeah.
This day and age
Yeah,
has
because-
nothing to do with
Okay,
day and age.
explain.
Has nothing to do with day and age. I think it is some cultural thing. I don't.
Yeah, because I'm surprised because they ask you.
It
do you
has
want to give
nothing
birth?
to do with
They ask
technology
her,
or something.
Do you have to give birth at home or in the hospital? I was thinking, why not? They don't need to ask me that question, no, because she need to give birth at the hospital. In case of any emergency, then it can be provided quickly. That was what I was thinking. But here, people give birth at home.
Yeah, because the midwife will follow you up and will even come to your house
Yeah.
to guide you,
Yeah.
to guide you, to help you out.
Yeah. Interesting. And interestingly too, the insurance cover all those procedures. Everything that
Oh,
she needed by then, everything was provided. And in all relating to health issue. One of the interesting also fact is that this one is going to surprise you. Maybe where I'm coming from, I've never seen that before. But here, I was told that we need to raise up the bed.
there is coming again.
Yes. We need to raise up a bed with a beer, a crate of beer. You know, the crate of beer. You
That
have
height.
that height.
Yeah.
So I need to put 4. No, almost, yeah, under the
Yeah,
bed. Almost.
we were having those pillars.
Yeah,
You
all
can
those.
rent those pillars.
So the bed need to go up. I said, why? Do you know why? She will tell you why.
Oh yeah, I will tell you why. This
Uh-huh.
coming after all the checkups by the midwife and you are getting in delivery. And let's say you do it. No, it's not let's say. Also, if I'm not, that is coming after the giving birth. Is coming a woman the whole week in your house to treat you and the baby
Yeah.
to take care of you. Yeah.
So, yeah, because she told me that
And
there was
Jerry
somebody
was
coming.
saying, what is that woman
Yeah.
coming to do the whole week in your house?
Yeah. You will get a woman who will come in to take care of your wife for a whole 1 week.
7 days.
7 days. She will come and bath the child, take care of. If your wife cannot bath, she has to bath your wife as well. Wash the clothing, prepare breakfast for
Yeah,
her.
oh, you
Excluding me, only her. Every treatment is for her and the baby.
You will
I'm
get
excluded.
nice breakfast. They will even design your plate. They will design it nicely, fruit, everything.
Everything.
They do.
Because it's like more or less, not more or less, it's like what I experience in Ghana is that my mother-in-law or my mother need to take care of my wife if she gives birth. They have to come and take care of her if she gives birth. So here they replace it with somebody else because it's like almost everybody is working. So
Unless you have been for long in the hospital, but after giving birth, but still you get some days if you come home.
okay. Even if you come, she will still have to come and take care of you.
Yeah.
If you
then
are more than a week at the hospital
Oh, then you can get some 2 or 3 days
with her also with the person.
with the person.
Wow. So
Yeah,
that
yeah, for me it's nice.
okay. So
She will do
you
something also with other children. There's always one day of pannenkoeken, pancakes,
Yeah, in the
and yeah, they will treat you.
So that is the healthcare situation here is so super interesting, huh? Because all those details that we are giving, it happens because all the 3 children that we have, there was somebody here to take care of her for a week until the person leaves, and the person takes every detail, take
And-
notes, write down everything, all the situations that is happening. She put them down nicely. But even you are going too far, even the hospital that she gave birth at.
Yeah, but even don't forget, by the last one I gave birth, I lost a little bit of blood and I was small dizzy. So the woman can even stay some 2 days longer if I wanted
You see?
because of my condition.
Wow.
So all those things, but you forgot something. You went a little bit quick forward. All the checkups,
Yeah.
when I went
Yeah.
the pregnancy.
Yeah. Yeah.
There were
Every-
1005.
They do a lot of checkups. Plenty. Sometimes I get tired of it, but yeah, what can I say? It's part of the system. Yeah, you go for checkup every year and there, this and that. You do all those procedures. So if you find yourself here in the Netherlands, don't be surprised when you go through all those procedures because as long as pregnancy and a human being is involved, they don't joke with it at all. They make sure they go to the length to find out every situation within the belly. So, and in what surprised one of the surprising thing also for me was when she was about to deliver in the hospital, we went there.
Oh, but we didn't finish the topic about why the bed need to be up.
Yeah.
It's for the back of the woman who's taking care in the house.
Yeah. Oh, okay.
Is she need to change the bed, otherwise she need to bend down for the whole week, because every day you will get a clean bed.
You see, that's a health situation, health system,
So
service.
it's yeah, we will say the arbo,
That is almost like yeah. How do I say it? It's
yeah, it's the law for
for the law binding somebody taking care of you. How good you have to take care of that person as well. Like the person need to be in a good condition to take care of you, not the person living and getting hurt or something like that.
yeah, let me put it
Yeah.
like that.
Yeah. So those we need to. So the bed I need to climb. You almost need stairs to climb the bed every day, and it's going to be there for almost how many weeks?
Oh, for long, you need to lift them up
I think
4 weeks,
4 weeks.
before delivery. Because what if your child is coming early?
Yeah.
But after the woman
It's
was
gone. Then
we
you can just
quickly
remove it. Yeah.
remove it.
Yeah. 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 So and also in the hospital here in the Netherlands, where the hospital we went to,
Oh.
and she gave birth the first time she gave birth, and they have to do a checkup the following morning. They have to do a checkup the following morning. I think I slept there. They asked me whether I would love to sleep also at the hospital.
Yeah.
And I said, okay. And I was surprisingly, they gave me a whole bed to sleep on. When she slept, there was a bed also there for me to lay down. In Ghana, forget it. You can't get that treatment. No, you will not get it. So I was really surprised because I was really, really surprised I got that
Oh,
treatment
here
as
is the
well.
hospital is not full. They can just let you sleep.
Yeah.
Not all, but
No, it was very surprising, and not and another thing that shocked me also was when you were about to give birth for the last time,
yeah.
and we went to the hospital. She was given a tablet before delivery. We went to the room, a very big room, where she would deliver, and the woman just came to prepare her and everything and gave her a tablet. Somebody who's coming to give birth, they give her a tablet to be watching
You can
Netflix
put
or
your favorite music on.
this is a luxurious treatment. Honestly, it's a luxurious treatment.
But the room was
Big.
the room was big and,
and
everything was there. Oh, yeah.
Yeah, I was so surprised. So basically, this is the tip of the iceberg of the Netherlands health system. We can't give you all, and it also depends on every hospital and the treatment they give. We are only giving you what we've experienced so far. So I think that is all for now, or for the health situation. When you find yourself here in the Netherlands, these are some of the things, like Ashley rightly said, from the house doctor. You don't go straight away to the hospital. You have to go first to the house doctor. If the situation is so severe, then the house doctor can refer you to the hospital. And before that, they have to call and prepare and find out if there's a space for you to go. If not, you have to wait. Here, protocol is very high. The protocol is very, very high.
Yeah, the protocol can be very high.
Yeah. There's no. If you have to wait, you wait. If you're in a queue, you are in a queue. Period. That is it. So those are some of the things that the health system here, and they really take care of you. If you are sick, they really do their best to take care. The doctors here listen to the patients very, very well. They listen to you and they do their best. That is one thing.
Yeah, there are always people who say it's not bad because I'm working in a hospital myself, but on the average, and comparing to Ghana,
The difference is big.
the difference
It's
is
big.
very, very big.
Yeah, it's very big because in Ghana,
Equipment and fastness and thinking through, or how must I say it? Yeah.
because and the hospitals here, the hospitals are not crowded. Not at all. The hospitals are not crowded. In Ghana, hospitals are always crowded. A lot of people every morning.
Yeah,
But
because
here-
we work here also plenty with appointments.
Yes.
Appointments.
Yeah.
So
Everything.
you can be on the waiting list for long, huh?
Yeah.
I'm not saying it can be, but you just wait.
Yeah. If you have to wait, you have to wait. Yeah.
It's digitalized. It's
Everything. Everything. So that is
the only thing is what we didn't say in the beginning about the health insurance. You really need to pay quite plenty in a month.
yeah, you pay a lot of money for the health insurance is expensive here. It's very expensive.
Yeah.
It's very expensive because you have to pay a lot and you are paying every month for it. And I think it has been raised. It has got next month, from January we have to pay another. It's going up again.
It's going up
Yeah.
again. Every
Yeah.
year
Yeah.
it's
Yeah.
going
And the children are
free.
free. Children are free till the age of 18. I think so.
And you
To the
must
age
not
of 18 or
Yeah, to the age of 18. You must not forget to say your medication, most of it is covered.
yeah, most.
And only
most.
some you need to pay some amount of money, but most of them are covered by the insurance.
Okay. Yeah, that is true.
With exception of
Some,
something, but there's nothing that you go to the hospital and you first need to pay something
No.
to get something done.
No, not at all. Not at all. Okay.
Yeah.
All right. So that is the health situation, the health system in the Netherlands. We are only giving you what we can say so far, but you can still do your research if you find yourself here in the Netherlands about the health system. So, yeah, thank you for watching once again, and thank you for liking and commenting down below. And my name is Jerry once again, and I'm here with my wife, Chantal.
Oh, Miss Chantal.
So thank you so much, and we will see you again in the next video. Bye for now, and stay safe. Bye.
Bye.